Balls Deep.
Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pizzona, a board-certified urologist and CEO of Pizzona MD. We hope you enjoy. Now, let's jump right in. Hey, Stream Team. Welcome back to another episode of Balls Deep, joined as always by Kat Williams.
Still here.
Still here. Kat, how you doing today?
Frustrated, mightily. I have had a flat tire. I have missed my hair appointment. And it's possible I may have a little head cold coming on. But I will say this. My nightmare morning is not as bad as dealing with health insurance companies. Am I right?
100%.
Yeah.
What a great segue into an episode here.
I worked on that.
Where today we're going to pull back the curtain and share the medical office's experience with insurance companies, because we get it. They make patients' lives incredibly frustrating. They make healthcare complex. And, Kat, we're both patients as well.
True.
We're at an age where we're trying to be preventative and doing some testing.
I have a mammogram tomorrow.
Yeah. And so we deal with the healthcare system from the patient side as well. So we get it. But I don't know if everyone understands what really goes on behind the scenes in doctors' offices. And I'm hoping to shed the light such that after today you go, that makes sense. That's why my doctor does A, B, and C. So you want to jump right in here?
Yep. Spoiler alert. It's not good.
Nope.
Balls deep.
Okay.
Where do you want to start?
Well, so we're going to talk about the tragedy that is insurance companies and how doctors and medical practices, you know how you have to deal with it as a patient. How do you, as a physician running your business of a private medical practice, what happens to you with insurance? Go.
Let's walk through the process a bit, and we'll break it down into different steps here. So people, I'm going to use some lingo just because
I will try to help decode it.
Yeah, because there's really no other way to put it. We've got to understand what these different terms mean to a degree, but really understand how much complexity is brought in when we use insurance companies. So,
number one.
So number one is insurance enrollment. So when I started Pizzona MD back in 2020, middle of the pandemic, I was like, good time to start a business. Let's go for it.
Wow.
And I went in with very noble intentions. I wanted to accept patients with all types of insurance, whether you had Medicaid, Medicare, Blue Cross Blue Shield, United, didn't matter. I wanted to try and take care of everybody. And of course, the amount of training we get this in medical school and our residency is a big old fat zero.
Training to learn how to do the enrollment.
Training about anything with insurance.
So nothing.
We're basically learning how to deliver patient care. The business of healthcare, we learn more or less zero.
Okay.
And in the insurance world, all we know is they're a pain in the you-know-what.
I think we can all agree on that.
So we have to enroll with insurance. What does that mean? I have to pay someone $4,000 to $5,000 per provider, so whether that's a doctor, nurse practitioner, PA, to, quote, enroll us in insurance contracts. So I say, hey, go enroll us with all the insurance contracts. And they go, all right, here's my fee. So behind the scenes, there's all these applications and letters that take many weeks and often many months. Sometimes
so it's not a fast process.
90 to 120 days is typically the shortest amount of time from application to you're enrolled with that insurance.
Okay.
Now, once I'm enrolled within that insurance plan, I am essentially entering into a contract with insurance. So actually, they're my customer because they're the one who pays the bills. I mean, it's odd to think about that, although as doctors, of course, my duty is to serve my patients. I'm really enrolling in a contract, not with my patients, but with insurance companies. And so I enroll with all these insurance companies. I get contracts. Now, you might ask, well, obviously, because you're a good doctor, you've been doing this a while, or you're a specialist, you can negotiate rates. Think again.
No, you can't.
The amount of leverage we have, especially when I opened the practice as a solo practitioner, was zero. They essentially handed me a contract, said, that's it. This is your contract for 3 years. Good luck. Take it or leave it. If you want to see United Healthcare patients, that's how much we're paying you. And if I shared how much we are getting paid to spend time with our patients, it is less than what I have to pay my plumber to come fix our leaky faucet, less than what we're going to have to pay the tow company and AAA
to
come
my
fix
tire.
your flat tire.
Okay.
So for everyone out there who's like, you doctors, you're rolling in all this money. Again, I'm not going to pull out my tiny little violin and say, woe is me, the poor doctor. But the contracted rates we get from insurance companies are pretty pitiful. In fact, most years they decline. But yet, even just inflation is going up a couple percent a year. So doctors' rates have actually been declining for the past 30 years. And if we simply just look at inflation, I started practice in 2008. I would have to be making 46% more today than I did when I started my career in 2008, just to be breaking even.
And I have a feeling you're not making that much more, are you?
Newsflash, I'm not making 46% more than I did in 2008. In fact, I'm making less. So that's step one. We get enrolled with insurance contracts, okay? So now, I've got the practice open. I'm enrolled. Doors open. Phone lines are ready. You're a patient. You call my office. Hey, I want to see Dr. Pizzona. Great. What insurance plan do you have? Oh, well, I think I've got Cigna. Okay, great. So now starts the process of what's called eligibility. So it's a two-way street. I have to, or our team has to make sure that that patient truly is enrolled in that plan, has an active policy, and you'd be shocked how many people have expired policies and have no idea.
Oh, wow.
You'd be shocked at how many people are pulling out the insurance card from last year, but their employer went from Cigna to United and they have no idea. Or let's enter in the fact that some people have multiple insurance coverage. Well, I got Medicare Advantage, plus I have a Farmers Bureau plan. And so you imagine I have to train every single person answering our phones, and we get 300 phone calls a day at this point to understand all this. Then here's the kicker. I might be enrolled with Cigna, but which of the 10 Cigna plans am I actually enrolled with?
This is unbelievably complicated.
Yeah. So there's a Cigna plan for Kentucky. There's a Cigna plan for the Amazon people. There's a different United Healthcare plan if you're an HCA employee. Like, there's all these complexities. And very often we go, well, you said Cigna. I'm going to put that in the chart, put down your number. Great. Only to find out 60 days later, actually, you're at a network with that specific Cigna plan, so we're not paying you a dime.
So all Cigna plans or all Blue Cross plans are not the same.
They're not.
And it's possible that your doctor could accept Blue Cross, but you have a Blue Cross plan that the doctor does not accept. Neither would be known by either party.
Correct, because
How
of the
are we
complexity.
living in this system?
It's
My
insane.
head is exploding.
And again, it's not out of intention. I
It's
started
out of
the
lack
practice.
of information.
Yeah, I started the practice of get me in, take all insurance. Well, here's the problem. You have patients coming from different places. You have different subplans, and there's all this complexity. And so why does this happen? Insurance companies don't want to pay their bills. I mean,
I think that's the bottom line.
they make profit by one simple method. Money goes in, they hold back a certain percentage for themselves, and then give out the rest to the doctors. Well, guess what? If you're a public company, United Healthcare, if that's the way you make money and you're beholden to your stockholders, what are you going to do? You're going to do everything possible to hold on to all that money.
Correct.
And so that is where, again, the complexity just starts with that eligibility.
So, obviously, for a physician, from the physician's perspective, massively tedious just to enroll with all and to be able to accept all of the insurance. And then you move into the process of trying to get paid.
Yeah.
That, I am guessing, is an equally tedious process. So once you're enrolled as the physician, you take the insurance. is it then just a matter of sending a bill to the company and then you are paid?
It'd be beautiful if it were that simple.
Wouldn't it?
Right?
I have a feeling it's not.
Imagine you walk into a Starbucks and there was no menu. And you said, well, I want a triple shot latte with some vanilla syrup. And the person at the cashier area goes, what sort of insurance do you have? Can you imagine how absurd that would be?
Sure.
What sort of coffee insurance do you have? Mm-hmm. And then you show and go, with yours, we're not really sure. So actually, your first 2 shots are in network, but the extra shot is your responsibility. I mean, it's just an absurd example, but yet we tolerate it with healthcare. So we're enrolled. We believe we've figured out we're eligible with a patient's insurance. We now see the patient. We believe in spending time with people. We believe in doing what's best for patients. God forbid we do these noble things, right? Do what's right for the patient. And then after the visit is over, we sign a chart. We submit what's called a charge slip, and we click a button that says sign. Then behind the scenes, I have to pay an entirely different company a fairly significant percentage of all of our bills to then send that bill. First, make sure that bill is, quote, clean and up to code, because there's all these complex rules about coding and diagnoses and all of this. They then send it. It goes through a clearinghouse, then goes to the insurance company. Then the flow of information goes back through the clearinghouse into our EHR bank account, we find out. Oh, and by the way, every single insurance company sends you that information in a different way. So not only are there 30 different plans we're keeping up with, but this one will mail you a check and a paper. This one's going to send you an email. This one's going to either send money directly into this account or not. But that process alone, even when it's fast, is a minimum of 30 days. I remember back in the 80s when you used to do layaway plans at different different stores, right?
Christmas layaway.
Well, last I checked, that doesn't really exist anymore. You got to at least pay some money or do some financing. Name me one other business where you may or may not get paid 30 to 60 days after you deliver services.
Can't think of one.
But yet we tolerate it in healthcare.
Now, all of these things that you just mentioned, I realize that sometimes I check out. This is true. And you were just speaking English, but I'm not really sure even what you said.
Well, because
you mentioned a clearinghouse, an insurance company, another entity who has to send the bill after you write a chart. I don't know what we're talking about.
I'll be honest, I run a medical practice. I barely understand it.
And you don't either. And that's the point.
I didn't go to medical school or residency to know this. And
so that's the point.
On top of that, some of these entities are all combined. So here's something that happened to our practice, and we didn't find out again until after the fact. There was a cyber attack back beginning part of 2024 on a company called Change Healthcare.
What is Change Healthcare?
Change Healthcare is one of these clearinghouses that processes payments and acts as a middleman. Again, let me take my cut, right?
Okay.
Between insurance companies and doctors' offices. They had a cyber attack that shut them down for 8 weeks. Well, guess what? We had the good fortune that our electronic health record and 100% of our billing went through Change Healthcare. So that means for 8 weeks, we received this much money from insurance companies.
$0 for 2 months.
2 months. I still had to pay for our 30-person team, our 3 offices, and they just shut down. Now, here's the best part. Do you want to know who owns Change Healthcare?
Ooh, can I guess?
Yes.
United Healthcare.
100% correct.
I actually knew that ahead of time. Sorry, it was a cheat.
But Point being, they
they
own that part of the process as well. Now, did United Healthcare send us any amount of money or anything of
as
substance?
A buffer?
No. They offered some, I forgot what they called it, payments of some sort. Mm-hmm. They were laughable. If you look at what our monthly overhead is, it wouldn't have touched it. And so, yes, there's this whole complex system where basically the best way to explain it is we see patient, stuff goes in Vortex, goes to insurance company, goes back through Vortex. We get information 30 to 60 days later. Now, in an ideal situation, what I think most people assume is we get paid our paltry contracted amount.
every single time.
However, what happens a large majority of the time are denials. Or even better, your patient actually has a high deductible plan, and so we're not responsible for this visit. You go ask the patient now for money. So now here we are. Again, it's 60 days later after the visit. Patient has been seen.
Treated.
We've seen them in the office. Maybe we have answered follow-up phone calls. We have sent prescriptions to pharmacy. Oh, that's not the right pharmacy. I want to send. My wife said she wants it to go to this one. Hey, I got a question about this. This information sheet that's 500 pages long says I might get headaches from this medicine. Is that true? And then we saw them again for a follow-up visit a few weeks later, make sure the medication's working. And so then that claim's going. And all this while, all this time on our team, which can amount to hours for a single patient, results in $0 in revenue.
So here's my question. Again, my tiny little layperson brain trying to take in and manage all of this complexity. How does a physician's office continue to make enough money to keep their doors open, to continue serving patients in this kind of a system? That seems almost impossible.
They don't.
They don't.
And so when you wonder, so let's go behind the scenes here a little bit. So for everyone listening, if you're ever wondering, why does my doctor why is it a 2-hour wait to get in? Why do I spend under 10 minutes with the doctor and they're clicking on buttons the whole time? Well, in order to just break even, I'm not even talking about making any sort of money, just to break even for medical practices.
To keep your doors open and functioning.
To literally keep your lights on, cover your rent. Oh, by the way, that wonderful EHR, electronic health record, that your doctor's staring at a computer screen clicking buttons. Who is that for? That's for insurance companies.
Not for your doctor and certainly not for you.
Oh, and by the way, they charge about $1,000 per doctor to use it per month. So all of that, all the staff, all the people we have to build into the team just to handle all that complexity, prior authorizations. We can go back to calculating out-of-pocket expenses, the revenue cycle team that makes sure all the money is going to come back and we get all that information. And we're seeing 700, 800, 1,000 patients a month, all of that. And the only way to make it work is you have to see more patients in a shorter period of time.
So it all rests on volume.
And I think that's bullshit.
I think it is too.
And that's why we're just not tolerating it anymore. We're going to spend time with our patients, but we're in a system that makes it really impossible. So you asked earlier, how do other practices survive? Well, some can get really efficient and really good at the volume-based game. They can hire the right people, spend years training them. The doctor only comes in for a couple key moments of your visit. There's no way they're spending 30, 40 minutes with you. And they've just got a system. And even then, that we're talking about decades of doing that in certain markets, people who've had better insurance contracts from 10, 20 years ago, not some new practice. Second thing they do is they double down on what's called ancillary services. So people go, wait a minute, $4.9 trillion is spent on healthcare. How can these insurance companies pay you less than you pay a plumber or got to fix your tire? Well, there's a lot of money being thrown around on healthcare. But it's for drugs, it's for surgeries, and it is for imaging and various procedures.
Is any of this money being spent on what I would just say are us, the patients, and our well-being? Not that a surgery or potentially a needed medication is not part of a well-being, but how much of that giant sum of money is really taking care of us?
Not enough, given how much we spend and how unhealthy of a society we are. But I think we could talk an hour about that.
Different level of talk. Yeah. Absolutely. So where does that leave us? Where does that leave physicians?
Well, so at least physicians typically with two different options traditionally. One, you sell your practice to a hospital. So if anyone who's been around as a patient for decades, the baby boomers and older have seen, I used to just go see my mom and pop doctor, but then they joined another group and then they got bought out by the hospital. And so we see that especially in the primary care markets. These big primary care groups are being bought up.
But if you sell your practice to a hospital entity, like you said, or I've even heard of people selling to private equity firms, there seems no way that keeps a doctor autonomous and keeps him giving the kind of care to his patients. I mean, then you're having to answer to somebody else.
You're part of a big bureaucracy.
You're part of a big bureaucracy.
100%. And that's, again, what we're seeing in healthcare and why there's so many burnt out doctors is because we went into medicine for relatively noble purposes. I don't know many doctors who I met through pre-medical training to medical school to residency who were not legitimately good people with good intentions, who were really excited, high achieving, really wanted to help people and use all that education for some good. We've turned them into robots. Robots who are widgets on spreadsheets, whose voice no longer matters. And so ultimately, if I'm part of one of these systems, I spend an entire day taking care of patients, giving my heart and soul, being empathetic, listening, making all these complex decisions, while still having to get my charts done and doing button clicking. And then I come home and I still have more charting to do, more messages waiting, because that bureaucracy, the only way the hospital systems or these private equity firms make money is, well, I either got to cut overhead, AKA give you less support, doctor, and you just work harder because you're on salary, you're a widget, I'm just going to keep riding you, and you're not going to complain, you're a doctor. You're not going to move your family. You'd have to go get a state medical license somewhere else and go through all this with someone else. And the way the money is made by these private equity firms and these hospitals is if you have enough patients under your umbrella, well, now when they need CAT scans, when they need surgeries, when they need to get chemotherapy, well, now we're talking about insurance companies paying out $10, $20, $30, $40, $50,000 in fees.
So in some weird way,
to the system
wants those things to happen because that's where they make their money, their big money.
We're in a fee-for-service system right now.
Okay.
Do more things, make more money.
Do more things to the patient.
Correct.
Do more surgeries, give more medication, more procedures, make more money.
Yeah. And that's why you see your doctor's offices selling out to these places. And that 100% compromises the patient experience for two reasons. Number one, you have a misalignment in incentives. My incentive then is not to be a good listener and spend a time with the patient. It's to try and do more things for that patient, whether it be prescriptions, x-rays, or tests. Secondly, when you're part of a big bureaucracy, and anyone who knows this who's walked into a big hospital system, the customer service, let's just be honest, it
not
sucks.
Great.
It sucks. And
all right, that's probably more accurate. It sucks.
It is terrible. And anyone who's tried calling a big doctor's office and you're put on hold, you don't get questions answered, no one gets back to you.
No one has the answers.
Well, guess what? We're on the phone with your insurance company for 2 hours sometimes. I mean, it is absurd, So when we look at all this, it's just not sustainable. And I want people to leave this understanding of all these complexities that are going on and why doctors are retiring early, why they're leaving, and why when your doctor goes and joins some big group, why they're doing it. It's literally to keep the lights on and keep things going. We've got to look for alternative models.
So, what are those alternative models? Is there an alternative model in the current system? What does a private medical practice do to sustain themselves?
Well, now we can go from a little bit of anger and passion to excitement. There is an option. And in fact, at Pizzone MD, this is what we're doing in 2025. And so you're just going to have to tune in next week to find out what that change is and how we can continue to serve our patients and honor that physician-patient relationship while still being a sustainable business. If, as a physician's office, I can't keep the lights on, what service am I doing you if I close my practice? What service am I doing if I just go and sell out to private equity or hospital who just sees all of you patients as dollar signs for all their bigger ticket items? So that's my option. That's one of my options, but there is an alternative. And we're just going to leave a little cliffhanger here and have to wait for our next episode.
Okay, he's leaving a cliffhanger, but what you're saying is there is a light at the end of the tunnel. There is an alternative, and we'll just hang on and you'll tell us.
Absolutely.
Okay.
All right.
Until next time.
Yes. Well, I think we'll maybe skip your favorite segment. Maybe
We'll skip it.
Maybe the tip of the week is insurance companies are awful. And
I think we all sort of knew that.
Yeah.
From the patient perspective, absolutely. But now hearing a bit more from the physician's perspective, I think it's an equal opportunity disaster for all of us from the insurance companies. And let's all look for something else.
Yeah.
It's out there.
And again, I'm a patient.
I'm a patient too.
You're a patient.
I'm going to be a patient tomorrow morning at 10:30.
Well, with that, Stream Team, thank you for joining us. Please subscribe to us on YouTube. Well, let's be honest, not we. It's Catherine. Is just great to look at, funny, and
I'm the best part of this thing.
That she is. I'm just the sidekick over here. So we'd love for you to join us, and ultimately, please show yourself a little bit more love and kindness. We are all works in progress, and these are opportunities to grow. Thanks, and have a great day.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our Stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pizzona MD, please visit pizzonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.